Today we are going to look at the corpus callosum. So what is the corpus callosum? So to start off with some questions, the first question is, what is the genu? Question 2, we want to ask what is the trunk? What is known as a trunk? Third question is, what is the splenium? So in this video, we'll know the answers to all these questions, and in the end of the video, there is some bonus questions. So to get started, we are looking at the parts. So the parts of the corpus callosum. So firstly, it includes we are just going to see the names. So the rostrum. So the first is the rostrum. So what is rostrum? So the rostrum, it connects the frontal lobe. So it connects the frontal lobe. So here there is an example. What is the example? Example is the orbito. It is the orbitofrontal cortex. Next, what we see is the second part of the corpus callosum is nothing but the genu. So what is the genu? So the genu, it connects the frontal lobe. Genu collects the frontal lobes and it is the anterior most part. Then comes the trunk. The trunk or the body. So the trunk of the body, what it does, it connects the temporal lobe. So this connects the temporal lobe. Then what we see is, we see the splenium. So what is the splenium? So if you see the splenium, it connects the two occipital lobes. So it connects the two occipital lobes. And another thing to know is that it is the thickest. The splenium is the thickest. So then we will look at what is the isthmus. So the isthmus is a part, it separates the body from splenium. So it is a part which separates the body from the splenium. And then we are just going to have some explanations. That is the fibers of the genu curve. So the fibers of the genu curve, it is a curve forward into the frontal lobe. So it curves forward into the frontal lobe and form the forceps minor. So it forms the forceps minor. So the next, the fibers of the trunk. So we need to know the fibers, and this is from the trunk. So what does the fibers from the trunk do? The fibers from the trunk, it extends. So it extends laterally. So it extends laterally as radiation. It extends laterally as radiation of the corpus callosum. Then what we look at is the fibers. So we have the fibers, and the fibers is from the trunk, and also the splenium. So the fibers from the trunk and the splenium which form the lateral wall. It forms the lateral wall and of the inferior horn of the lateral ventricle. And what it does is it constitutes the tapetum. Then we look at the fibers. Next is the fibers. Next we look at the fibers from splenium. So the fibers from the splenium arching backwards into the occipital lobe. The fibers from the splenium, it arching backwards into the occipital, lobe, and this forms the forceps major. So now we get back to answering our questions. So the first question we asked was, what is the genu? So genu is nothing but it connects the frontal, it connects the frontal lobe, and it is nothing but the anterior most part. It is the anterior most part. Next, we asked what is the trunk. So trunk is also known as the body. So what this does is it connects the temporal lobe. It connects the temporal lobe. Thirdly, we want to ask, what is the splenium? What is splenium? So splenium basically it connects. The splenium connects the occipital lobe. So splenium it connects the occipital lobe, and it is nothing but the thickest part. It is nothing but the thickest part. And now we will ask some bonus questions. So these bonus questions you can answer it in the comments. So we have a bonus segment here. So the first question we would like to ask is, what is the isthmus? What is the isthmus? That will be the first question. And the second question is, what is the rostrum? So you can answer these questions in the comments.